So this is the major infectious diseases of humans. So basically it's a chapter where we're going to run through skin diseases, ear diseases, eye diseases, respiratory system, oral, the GI, the GU, the blood, the brain, and the nervous system. And then opportunistic infections, emerging and re-emerging infections. And then talk more about how your microbiome actually helps prevent diseases or how changes to it can lead to diseases.
So this would be a very important subject, right? Or exam?
It would be a pretty good one, yes. So you can either get a disease by a microbe because it releases something that makes you sick, or the fact that it's there and it's burrowing into your tissues makes you sick. Infectious diseases are caused by the pathogen colonizing some part of your body. So when you get strep throat, it is actually the bacteria burrowing itself into your throat that's causing the pain, and then some of these will actually affect, they can move from place to place and infect more than one place. Some of them only work on one place. So the diseases of the skin, this is just a review. Remember the epidermis and the dermis. The epidermis is that very, very thin layer at the top, and the dermis is the thick layer that's mostly made of connective tissue with a lot of blood vessels and nerves going through it. Dermatitis is the inflammation of skin. Sebaceous glands secrete oil. Folliculitis means that the area, the follicle area where the hair is coming out, is actually inflamed, and that will usually cause some sort of redness and a bump of sorts. Styes are another thing that you find on skin, usually places like in the eye or in the mouth where you have mucus. Right here, stye.
Oh, right up there.
Yeah.
This one?
Mm-hmm.
You went down, I went up. Not Sylvester Salon? What is it?
It's something that typically occurs right at the junction where the skin becomes a mucous membrane. The most common place you see this is in the eye. Furuncles and carbuncles are different versions of bumps, red bumps. A macule is a flat discoloration. A papule is an elevated lesion. A pustule has pus in it. A vesicle is basically a pustule that is leaking pus. Yes. So here's that review of the skin itself. That the epidermis is just this very narrow part at the top, and the dermis is where the blood vessels, the nerves, where the origins of the sweat glands and the oil glands are. And then the subcutaneous layer. So here you can actually see the different lesions. You can see that a macule doesn't elevate the skin at all. A papule does. The vesicle has fluid in it, and it quite often seeps the fluid. And a pustule has fluid, specifically pus, in it. Easy enough, right? By the way, I'm going to come back. One of the reasons burns are such a big deal is because if you go back to that picture with the dermis where all the blood vessels are, if you damage the epidermis and damage part of the dermis, infectious organisms can now get directly into the blood and they can spread throughout the body.
At what level? First, second, third degree?
I mean, third degree for sure. Second degree, possibly. First degree burns, no. Those just hurt. Second degree burns, your big problem is when you get the blisters, when they actually break open, something could get in there.
So if you're second degree burn, you should not try and break the blister, but to maybe wrap it up?
You should wrap it up with gauze, sterile gauze,
Put some cooling stuff.
something water-based. Aloe vera would be good. Aloe vera is one of the best things you can put on a burn. Just never, ever, ever put something oil-based on. A couple of years ago at the Basilica block party, I had a girl come in who we had to actually bring her into the central station for first aid. She had second degree burns all over her body where she had blisters that big.
What did she do? She threw herself on the fire pit?
No, she was very fair-skinned and had spent the entire day before.
Sunburn. Oh, poor thing.
As had spent the entire thing in entire day tubing on some river without any sunscreen, and then she comes to this party that's again, it's the middle of July, outdoors on asphalt.
How old is she?
And her father had told her to put cortisone on this.
Oh.
Cortisone is a fat-based product. It traps the heat inside and makes it even worse, causes the burn to get worse.
Crying and blowing.
Mm-hmm.
What were you doing at the Basilica party attending to second degree burns?
I run the medical team for the Basilica block party.
Oh, we volunteer there?
Yeah.
I haven't gone there. Okay. There's always so many people there.
There are a lot of people.
Yeah.
So yeah, don't ever put anything oil-based or fat-based on a...
Because a lot of people just think cortisone is helping to reduce.
Well, that, and for some reason, there are a lot of old wives' tales, especially in the Midwest of America, that you were supposed to put butter on burns.
Oh, I never heard. Chinese don't tell us to do that.
Chinese is actually the stuff the Chinese typically put on the burns are actually better. They just stink. Oh, do they smell?
Okay, so no oil based.
No oil based.
Perpetually any kind of burn.
Mm-hmm. All right, diseases of the ears. So how do you get into the ear? You either get in through the outside, through the external ear canal, through the throat, or nose, or through the eustachian tube. Or you can get through the through the blood or the lymph. So if it's getting in through the throat or the mouth or the nose, it's getting in through the eustachian tube. There's a little opening in the back of the throat called the torus tuberalis. That's where the eustachian tube is supposed to drain into the back of the throat. I don't think it's in that picture, no.
So where is it in this picture? Right behind?
So this opening right here is the torus tuberalis. They just don't have it labeled.
The arrow?
Yeah, where it says pharynx. So where the eustachian tube drains into the pharynx.
Where again?
This spot right here.
I can't see a red spot on the screen. It's so bright.
Oh, okay. So it's right. Now I'm blocking it. Okay. This area right here.
Oh, I see that pharynx. So that's where you.
That's where the throat meets the eustachian tube. So if something is getting into the ear from the throat or from the mouth or the nose, it's getting up through that spot.
So pathogen gets in this way.
Mm-hmm.
Isn't it easier to get in from this way?
No, because the tympanic membrane is an actual connective tissue membrane that makes it hard to get through. So you can't. If you get through that, you've damaged the tympanic membrane somehow or other, which can happen.
Yeah.
And you can get a bad enough ear infection that it's on both sides of the membrane.
So most infection comes up by the pharynges. How you pronounce it?
The pharynx,
Pharynx.
or the eustachian tube, yes. I mean, that would be how you would get. That's the most likely way to get some middle ear infection, something coming up from there. And usually we're talking about the stuff that would normally be in your throat. Or it could be something like a streptococcal bacteria getting up there or what have you. More often than not, when people say they have an ear infection, though, they don't have an ear infection, they just have a problem with that, the eustachian tube draining.
Draining for mucus?
Draining the fluid that's produced. So it's producing fluid in that middle ear all the time, but it's supposed to drain into the back of your throat. If something happens to cause that tube to be inflamed and the opening to be decreased, then the likelihood of you getting extra fluid in the middle ear and putting pressure on your eardrum and causing pain goes up. Little kids get this more often because the eustachian tube tends to be more horizontal and narrower in the first couple of years of life, and then as they grow, it becomes more vertical and wider.
Is it station tube?
Eustachian, E-U-S-T. Yeah, eustachian tube.
That's why I put, when you said eustachian, I thought it's just station tube?
No, eustachian tube.
And that's the name of...
That's one of the names. I mean, you could also call it the pharyngotympanic tube or the... All right, eyes. So with the eyes, you've got...
I got keratoconus.
You got a keratoconjunctivitis?
Actually, keratoconus is what they called it. That was like 10 years ago. So I was diagnosed for 2 years. That's why I went to massage school.
Mm-hmm.
But then it turned out to be a misdiagnosis. I went to Minnesota Eye Consult. I was supposed to go this morning, but I canceled. So 2 years of going to University of Minnesota.
Yeah.
They told me I'm going to lose my vision, but don't know how long it takes. So I say, what's the worst? They say, well, cornea transplant. I say, well, what's the chances of my getting cornea transplant? He says, well, it could be 5 years, it could be more, we don't know. So we will treat you until the stage comes and you're legally blind. So I was with them for nearly 2 years. Never got better, and I'm always treated like a scapegoat. So every time you go, you go through all the different stations to test this and that. And if I can't see, there's no point in taking my vision and asking me what alphabet ABC.
Right.
I'm so frustrated. So after 1.5, nearly 2 years of going there, I don't have money because I don't have insurance. My ex didn't have insurance.
Right.
So I pay out of pocket. And the head of cornea, Dr. Kaufman, never see him. He's still the head there. So he told me, he says, don't worry, you just go for community care. They have whatever.
Right.
Yeah, so I went to check and he says, no, we can only give you discount on the treatment. So the treatment for the doctor is $300.
Right.
So the discount is maybe 90 something, nearly $100. But remember, University of Minnesota has 2 bills. One is for the doctor and one is for
the facility.
Yeah. Yes. I still pay. I can't afford paying for so long. So in the end, I just succumbed. My friend says you have every right to go to get medical insurance. So I went to medical insurance, and first time I got it, I went to see Minnesota Eye Consultant. I googled who's the next best choice, and that's why I'm seeing Dr. Hartley now. I could see for the past 8 years after the surgery perfectly. I've always been whole family. I'm from H1. All of us has always been myopic. We use contact lenses and we use glasses, and I have high astigmatism. I've been seeing perfectly for 8 years after the surgery. First time I saw him, he told me, he says, I know you're very frustrated. It's because I finished my school. Then I asked him, and he says, I'm going to do surgery for you. I said, oh, I thought it takes 3 months. I called him and keep calling him, and I got somebody to cancel. And he gave me surgery in August. My exam finished. I gave me surgery in September. I've never had surgery all my life, so I was nervous. He gave me surgery. He says, yeah, it's going to be easy. It's going to be monovision. Do you know monovision?
Mm-hmm.
So what he did for me is not just corrected the problem with my eye. He actually put lens in both my eyes so I could see far with this eye and near with this eye. So when you put the two eyes together, it balances. So I've never had to wear glasses. Imagine at my age, I should be using reading glasses. So you got to learn to like this, if too near or too far, then you read better. So I've had good vision for a long time now. But because I already have a lot of cornea vision, like floaters and all that, that can't go away. So he tell me, he says your vision is okay. That's why you see sometimes I blink and sometimes I, do stuff and sometimes it get all foggy, So I'm supposed to go. That's why I was diagnosed with keratoconus. How do you know this disease?
How do you know this? Well, I mean, conjunctivitis affects the conjunctiva, which is that area where the eyelid, the underside of the eyelid, basically where it meets the eye itself.
So,
and kerato refers to the cornea.
When I was young, I always had conjunctivitis.
Mm-hmm.
Anytime I see somebody with red eyes, I'll get it. Whatever, like we say, you just see and you get it. But, when I was young, my great grandmother, she used herbal stuff, so she did. I know it looks like mimosa or what, and she'll just collect and da 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 da, and then she'll prick and blood release. That's why I was born with this style of background, so family. So she'll prick my ear and drip the blood in, and then stuff something like mimosa, and then stuff it up the nose, and it helps the whole system, the ear and the nose. I don't know, whatever, but that's how I remember.
Well, one thing might be, and that this could actually lead to keratitis, is that you don't make enough natural tears.
Yes, I always have chronic dry eyes.
And then
recommend.
Well, and doing something.
Forever.
Well, putting something spicy or hot up your nose will actually trigger extra tear production.
It's just herbs. And then she did some herbs with like something like cactus with some meat for drinking to cool, because when you talk about redness and all that, I don't see the Western doctor after that, never. And then when I passed puberty, I didn't have the top problems anymore.
Right.
Yeah, but when I was young, I don't know how. I can't see someone with if you have conjunctivitis, I'll get it just looking at you. I don't know why.
Well, that probably still means, I mean, that's mostly due. So all of these things are due to a bacteria infecting your eye.
But then,
if you have the right amount of tears and you have the right amount of enzymes that you should have in your eyes, most people won't get this stuff unless something is inhibiting that.
So you're saying I'm born with something that is missing?
So you're missing the tears, or you're missing
tears, I think.
The enzymes in the tears.
Okay.
And if you're not making enough tears, well, then you're not making enough of the enzymes to begin with. So you're not fighting off the infections as well as you could.
So it is still something infectious that I should pick from someone, not just by looking. So
it's still a contact thing. So they rub their eyes with the infection, they touch something, and you touch it, and you've got it.
From just looking, I get it.
No, there's got to be actually touch to touch, but it's
that way, because everybody with conjunctivitis, I'll be the first one to get it.
But I mean, all of it, conjunctivitis is just a bacterial infection of the conjunctiva. Keratitis is inflammation, usually due to infection of the cornea.
How they explain to me keratoconus is because the cornea is supposed to be round, but my cornea is curve shaped. That's why it doesn't bounce off the light from my eye, and that's why I see. Well,
that's an astigmatism when you have a bump in the cornea.
No, it's not an astigmatism. I'm seeing it's like Halloween every day. When I was in massage school, I was seeing practically like the whole body, your head is moving forward.
Oh, wow.
I was living that type of world. That's why when I went to massage school, I don't know how I did it. Because I went to school like 2 years, and it's in winter, I can't see, but I made it to school and back. And that's why I told myself, when I graduated, that's why I got quickly go and see a doctor and get, something done.
Infectious diseases of the respiratory system. Basically, here you've got upper respiratory infections and lower respiratory infections. So upper is your mouth, your nose, your sinuses, the larynx, everything from the voice box up. The lower is everything below the voice box, everything below the larynx. So the trachea, the bronchi, the alveoli, the lungs themselves. Now, your upper respiratory tract has a whole bunch of normal flora, indigenous microbes, that if they stay there, they don't cause any problems. But if they manage to migrate into the lower part of the system, they can make you really sick. And in fact, a lot of times when somebody gets a cold or a flu and then they end up getting pneumonia from it, it has to do with the fact that the normal flora, the stuff that's always there, traveled down because the respiratory infection made their immune system weaker. It hindered the normal reaction to something infectious.
So it's the pathogens that make the lower respiratory weak, then the upper goes down.
And the really scary thing about that is the lower respiratory infections, pneumonia for the most part, is the leading cause of infectious disease death. If you die from an infectious disease, more often than not, it's from pneumonia.
My mom passed away of pneumonia. Now nobody expected her. 3 days in the hospital, and that's.
Well, and it's one of those things. People with HIV will die of pneumonia. Pneumonia or cancer are the things that kill you if you have AIDS. People who older people who break a hip, this is the most common reason that they actually die, is because they end up sitting in a hospital bed for weeks, not moving around.
Also too, right? My mom actually.
Well, ribs would be pretty bad too, because if you break a hip, you could still do respiratory exercises to prevent pneumonia. If you break a rib,
she was better.
You would have a hard time doing those exercises.
She fell down.
Mm-hmm.
So she fell down and fractured her arm. And then she refused to stay in the hospital. But when she fell down again, coming out from the restroom, you know how it is, they got problem getting up, so they pushed themselves and she
broke a rib.
Fractured her rib. So we says, no, the hospital needs you there. We told the doctor to collaborate and says, no, you don't allow her to go back because nobody's home. Because we were planning to get a maid, but then it takes a month or so. So she was in the hospital for a month. But out of the blue, they say she got pneumonia. Then second day already, I got a call from my family. They say the doctor says she's not succumbing. She's not responding to antibiotics.
Mm-hmm.
So if you're not responding to the antibiotics, he says it's not going to work. You're going to send the family back. So that's why they told me that.
Mm-hmm.
But too late. Third day she passed.
And again, you're talking about bacteria like all of the things that cause strep throat, strep A, strep B, but you're also talking about, like, there is a bacteria called Haemophilus influenza that is normally in the back of your throat, and as long as it stays there.
What disease is what?
I know I know it sounds like it should be a virus, right?
Yeah.
And it's not, but if it's up there, it's fine. It doesn't cause any problems. It's when it actually goes down into your lower respiratory tract, it will cause pneumonia.
Give you strong antibiotics to fight the lower.
Right. To prevent you from getting. It's very, very common if somebody's in the hospital with an upper respiratory infection or with something that's going to keep them immobile, to put them on antibiotics to prevent them from getting pneumonia.
That's how they know when they say,
Mm-hmm.
say, well, she's not responding, there's no way she's going to recover.
Right. And there's a picture you can see. Upper respiratory tract is everything from the larynx up, and everything below the larynx is the lower respiratory tract. So here are your diseases. Bronchitis is basically, respiratory infections. Infectious diseases of the respiratory.
One of your question came, your test came out. You spelled CARR RRIES. I was wondering what that is. Okay.
Bronchitis?
No, I was just flipping a page and that's infectious disease of oral cavity. One of the questions, whether you will get dental caries or gingivitis or bad mouth or
trench mouth. So bronchitis is an infectious disease of the bronchi or the trachea.
Why don't
So,
I have that page?
I don't know.
I think it's printed. Oh, maybe I found it wrong. Because sometimes the printed printout it goes.
Oh, sure.
Okay. Yeah, right.
Bronchitis will be inflammation of the trachea or the bronchi, and this will often be infectious. Bronchopneumonia means now you've gone from bronchitis to pneumonia, and you're getting fluid not only in the alveoli of the lungs, it's backing up into the tubes of the airway. Pneumonia is just when you have fluid in the lungs in the alveoli themselves. And it can be bacterial or viral.
It doesn't matter. It's both deadly, right?
Well, both can be deadly. Bacterial will tend to be more deadly more quickly. If somebody has what they call a walking pneumonia, it's usually a viral pneumonia.
Who has walking pneumonia? I mean, you can still walk around.
Yeah, you can still, you feel, you don't feel good, but you're not so bad that you're stuck in bed. Pharyngitis, that's a sore throat. Most common bacterial cause is strep. Different versions of streptococcal bacteria.
So, you say pharyngitis is the most common form of strep throat?
Yeah. In fact, the technical name for strep throat is streptococcal pharyngitis.
Why is that?
That's the bacteria that likes to colonize that area and cause.
I have not heard of strep throat or streptococcus when I was young. It's only when I hear them here. Why is it because of different type of food we eat here? Or how?
I honestly don't know what the rate of strep throat is in Asia versus here.
We have excessive sore throat from eating stuff, but we don't have strep throat. Like people tell me strep throat. In school or anywhere, at work, people are sick from not coming in and they call it strep throat and everybody understands it. What is strep throat? Why is it so it's contagious?
It's very contagious because if somebody coughs or sneezes, the bacteria is in the droplets. If you cough into your hands and then shake somebody's hands, guess what? You just spread the disease. It's massage, yes. And then, with little kids, how good are little kids that actually, you're supposed to cough into your elbow instead of into your hand. Half of the time, little kids don't even cover their coughs, and the other half, it's probably into their hands, and then they go touch somebody or something with it.
So how long does the virus, you cough?
It's a bacteria, so it can actually last for minutes to hours, yeah.
So if you cough into your shirt, it's still contagious?
It's still contagious, but you're less likely to do this to somebody than you are.
Yeah.
And your shirt is typically drier and cooler than your hand is.
It can stay for a few hours?
Mm-hmm.
No wonder that's the only time the company will accept people calling in sick. Otherwise, they say you're sick, you better get medical leave, medical kit, from
right. Laryngitis is when your larynx gets inflamed. This is just as likely to come from people yelling or screaming too loud as it is from an infectious disease. Other than pneumonia, the scariest thing on here is epiglottitis. Epiglottitis. So it's an inflammation of the epiglottis. And this is what happens with stuff like croup and whooping cough. Especially whooping cough or pertussis. It's a heavy cough, a really hard cough, and then when they inhale, there's a type of sound to it. And it infects little kids a lot and can kill little kids.
Wow.
Because it can block the airway, which is why pertussis, which is the technical name for whooping cough, why that is a vaccine that people typically get. Because it can kill kids.
For kids?
Yeah.
So it means it's recommended to give.
If you get it as an adult, you'll be miserable for a couple of days, but you won't die. If a 2 or a 3-year-old gets it, there's a chance they die.
So you would recommend taking
The vaccine?
Vaccine when they are little, like
Definitely the little kids, and definitely the parents of little kids. If you spend time around the little kids, you should get it too. Because again, you could harbor the bacteria and not get sick or get mildly sick, but your kid could get terribly sick.
So not too late to have vaccination, any kind of.
No, and it's actually one of those things that every 10 years they'll bring up at the doctor's office. Sinusitis is inflammation of the sinuses, usually caused by a bacteria or a virus. And any number of them can cause it. And basically the sinuses will fill up with fluid, and the cavities are lined with membranes that are sensitive to stretch. So as they fill up, it's the stretch that causes all of the pain.
Yeah, sinus cases come from massage.
Yeah.
Especially with allergies and.
Allergies tend to make this worse, or having a cold can trigger it. And people who get sinusitis typically know that if they get a bad cold, they're going to get the sinusitis afterwards.
That's why they stand by histamine and take them, or?
Well, I mean, antihistamines will help.
Yeah. But not all the time.
Not all the time. Acupuncture actually does help sinusitis quite a bit if you put needles right over the sinuses. And also massaging or pressuring it seems to help.
Yeah, I do a lot of sinus.
Infectious diseases of the oral region. So you have so many bacteria in your mouth and so many other things in your mouth. And everybody's mouth is a little different, but most people will have at least 300 different species of microbes.
300.
Yeah, most people will have at least.
I went to Google, somebody who doesn't clean their mouth could have a million types of microbes.
Well, and those microbes do a whole bunch of things. Some of them are completely harmless. Some of them are not so harmless.
I used to take care of high school kids, foreign high school. I was a coach for a couple of years. And the kid will wake up and just change and get ready to school. I say, what? Go brush your teeth. I mean, he's like 16 years old. I have to tell him that.
Right.
He says nobody cares. I say, no, when you talk, I can smell. Imagine in the car, I can smell. I don't even know how you last in school. I said, 16, don't.
Where are they from?
About China.
I don't know. But I mean, if you have unchecked bacteria, so staph and strep, a whole bunch of versions of staph and strep bacteria normally live in your mouth, just like they live on your skin. They're part of the normal flora. The thing is if you leave food in your mouth, even tiny, tiny little particles of food that you might not even know are there, but if you don't brush and floss every day, once or twice a day at least, you've got food for the bacteria. And as the bacteria are eating that, they release acids that can wear away at the teeth and damage the gums. And so dental caries is the technical name for cavities. And the bacteria in your mouth eating the food that you left over are the things that actually cause that cause the cavities. The acid that they're releasing wears away at the enamel and eventually damages the teeth. And yeah, it can also damage the gums, and then you get periodontal disease, gingivitis specifically, or periodontitis.
I'm going for paracleaning every 3-4 months because of my perfectly clean teeth. It gets trapped, and then there's different types of food.
So let me ask you this: if you were Googling all this stuff, did you Google trench mouth?
No, because you didn't put trench mouth as one of the
possible choices.
You put foul mouth and bad breath or something like that. Is it foul morning mouth or evening?
Yeah, morning breath.
And
so that's actually caused by the bacteria in your mouth.
Yeah. So what is trench mouth?
Trench mouth is actually it's a horrible both bacterial and fungal infection of the mouth that's gotten so bad your teeth are falling out and your teeth are rotting.
So you're talking about people that is living under the bridge?
You're talking about, I mean, homeless people will quite often have this, or people with severe mental illness and the ability to take care of themselves has gone away.
Yeah, so it's okay. People from neglect. Trench mouth. I have seen people who don't brush teeth for long. I hired a neighborhood handyman to do some. He's big, he's 400 pounds. And he talked to me. You can see all the slime between the teeth. I think, I wouldn't call him anymore.
He's probably a nice guy too, but it's like just get some Listerine and swish it around, right?
So he doesn't. You can tell he doesn't brush his teeth because you can see the coating. You know the stuff, and then when he talks, it's all the slime between the teeth. Oh, I don't even want to talk to him. His sister recommended, but he doesn't live there, so. Gingivitis is from.
It's gum inflammation. It's a type of periodontitis. If gingivitis is bad enough, people's teeth could start to fall out.
So, if you don't get perio, then you get gingivitis. But if you have perio, you shouldn't get gingivitis. Right?
Well, periodontitis is just a general inflammation of everything around the teeth. Gingivitis is specifically of the gums.
Oh.
So now you're ready for the gastrointestinal tract? So your GI tract is full of microbes, and things are constantly coming and going. So you've got the transient stuff that's coming, that's going very, very quickly, and you've got the resident stuff that stays there, and even as some of it leaves, it's reproduced enough to stick around. If you ingest a foreign microbe, so if you eat something with bacteria in it that could cause an infection, the overwhelming majority of those bacteria are destroyed by your stomach acids. It's only the really hardy ones that get by and cause problems.
You're talking biles or something else? Biles, B-I-L-E, bile.
Bile? No, bile is created by the liver and secreted into the small intestine.
So the stomach.
It's the stomach's acid.
So much acid is stronger than biles.
It's waste, yeah. The stomach acid.
I'm usually not sick, so I don't really know the basic stuff.
The stomach acid, the acid in your stomach is primarily hydrochloric acid. Its pH is about 2.4. It is more acidic than Coca-Cola. It's more acidic than all these things that are awful for you. It will destroy most things that make it there. It won't destroy the things that have capsules or that have the normal flora of the stomach is obviously adapted to that. And there are bacteria that live in your stomach just fine. In fact, one common bacteria in your stomach, H. pylori or Helicobacter pylori, if it's there in small amounts, is fine. If it's there in large amounts, it's the main cause of stomach ulcers.
How is it that maybe it's from my work? I usually get gastric if I skip a meal. The acidity is from stomach acid, for a stomach ulcer or gastric. How does gastric come about?
Gastric?
Yeah.
Well, gastric is just an adjective for the stomach.
Yeah, I get this acidic build-up that, I would.
And then it comes up the esophagus, or?
No, it didn't come up, but you can feel the acidic build-up, and I know that I need to eat because sometimes I skip my meal, and this will happen because of my sugar.
Well, if you haven't eaten anything in a while, the acid level of your stomach will become greater.
Yeah.
If everything is right with the esophageal sphincter, you shouldn't really notice that, but you probably noticed all the other signs that your stomach was empty. If there is an issue, and some of that's escaping back into the esophagus, then eating will definitely feel good.
Because of my shipping days when I'm busy, I don't even eat for like 18 hours, and then when my stomach gives me rest, I'm like, okay, so that's why my system have to eat a little bit of whatever. So that's from acid from stomach.
That's from stomach acid, yeah. So GI diseases, colitis is inflammation of the colon. Diarrhea is basically when you have watery, runny stools, which both of those can be caused by bacteria or viruses, or the colitis can be caused by autoimmune diseases. Dysentery is caused by microbes, usually by amoebas. Enteritis is inflammation of the intestines. Gastritis is inflammation of the stomach. So when you put them together, you have gastroenteritis, inflammation of both the stomach and the intestines. And hepatitis is inflammation of the liver, and it's caused by a series of viruses. So you could have a whole bunch of things that cause gastrointestinal tract infections. I mean, diarrhea could be from bad food, so it could be from food poisoning. It could be from drugs that either increase water secretion or decrease water absorption. If you have a viral, bacterial, some sort of, or other microbial infection, that in and of itself can cause diarrhea, because diarrhea is just a quick way to get rid of pathogens that are in your gut. It's the body's way of flushing everything out.
Because whenever I have exams, I always have extra, activity. It's anxiety.
That has more to do with your autonomic nervous system, the sympathetic parasympathetic interactions.
Yeah, because I say it's not the microbes.
So it's not a microbe issue, but there are things other than microbes that cause diarrhea and constipation.
My case is exams. I always find that it's easier to go to the restroom.
So here you can see a picture of the GI tract, and
what is helminths?
Helminths are worms.
Worms, stomach worms.
Like tapeworms or other worms.
The normal part of the system.
Right. No, you should not have worms in your digestive tract ever.
We should all have tapeworms. We were brought up telling us that we have tapeworms and to make it worse, but stop. We don't have tapeworms.
No.
How do you know?
You normally should not have tapeworms.
How do you know if you have or don't have?
Well, honestly, the easiest way to find out is look in the toilet and see if you see worms wiggling around in your stool.
I mean, from young, we are always taught to look at your stool and observe, how, like TCM, observe. What are you thinking, right or wrong?
And so this is a picture reminding you, you're an AMP2 now or AMP?
No, I skipped AMP2 because they wanted me to take your midterm last trimester.
Okay.
So I can only take AP2 next trimester.
Okay, so you haven't had the digestive anatomy yet. Okay, so I'll go over it with you real quick. There's the liver. It's in the upper right quadrant, and the gallbladder attaches to it. Oh, you've got these in the wrong order?
No, it's like reproductive now. Sometimes, the printer come out, it's like just throw out. I don't even have it. Never mind.
Well, then just watch up here. Can you see the pointer? So right there's the liver.
I can see the pointer is too bright.
Okay, well then let me do it this way.
Switch off the light. Ah, yeah, now I can see.
So there's the liver. And the stomach. The stomach leads into the duodenum, which is the first part of the small intestine. And then there's the jejunum and the ileum. The ileum is the most distal part. And then you go into the cecum, which is the first part of the large intestine or colon. the ascending transverse, the descending colon. And then the sigmoid colon is the place where feces typically waits and accumulates until a bowel movement.
So when you hold your bowels, it's sitting at the sigmoid.
Yes.
And then sometimes you hold too long, it doesn't come out because it's jammed.
That's possible.
That's why you don't want to hold it.
That's why you don't want to hold it too long, right? And then you've got the rectum, and then the anus is the external opening that allows everything out. So all of the diseases and things that can affect this, it helps to know the different parts.
The 9 quadrants?
Well, you've got 9 quadrants, or you can have 4 quadrants or 9 regions.
9 regions.
In medicine, nobody uses the 9 regions. They use the 4 quadrants. So it's all upper right, upper left, lower right, lower left.
So because one of the AP question came out, and and I asked Finnegan to try and explain it. So he started drawing, and I said, wait, the liver is in first, second, third, and middle.
And it's in all of them, yeah.
How to remember? Because for me, it's like remembering where is where because of exam. And he left it there. So the next class, when the kid said, who did that? I said, how come he didn't teach us this in AP2? He teaches in AP1. I said, no, because I asked him specifically, we learned that.
But in the medical world, people divide it into the quadrants and then use that, because it doesn't really matter if it's in the right hypochondriac region or the right or the epigastric region.
That's why I thought when there's so many the organs in different,
they cross into different places, right? And even the liver, you could find a little bit of it in the lower right quadrant or the upper left, but the majority of it is in the upper right quadrant.
The reason why I asked is because it came out as a test question. And of course, I only remember what I remembered, and because he didn't teach it in school, in class, I actually Googled and I reproduced what I Googled. And I got it wrong, and I showed him evidence. This is what it says on the internet. He said, don't follow that, it's not accurate. This is what you should understand. So, the organ is found in different places.
So, I mean, one of the things, too, to understand is, like, the colitis is an infection of the colon. Enteritis is an infection of the small intestine. Gastritis. And all of these things are caused by different microbes.
You don't have to know which part of...
No, of all of the digestive stuff, the most important ones to learn, especially for your board exams, are the viruses that cause hepatitis. What's that?
Yeah, only interested in different...
Well, there's a few reasons for that. I mean, hepatitis, and next week I think we actually get into a lot more detail of hepatitis. But I'll give you the quick down and dirty of it. You got hepatitis A, B, C, D, and E.
Yes, we just see the CNT and say, whoa.
And hepatitis, if there was no HIV, the thing healthcare providers have been freaking out about since the 1980s is hepatitis B. It is sexually transmitted. It is transmitted the same way HIV is, but it's a much hardier virus. So it's not killed super easy. I mean, HIV outside of the body dies within seconds to minutes. It's destroyed. Yeah. Hepatitis B does not get destroyed that easily. And a needle stick can cause that just like it can cause HIV. And since you guys stick people with needles all the time,
that's why it's like
you need to know about it.
The questions are mostly on hepatitis.
Right. Yeah. And I mean, hepatitis B is an STD. It's sexually transmitted. It's transmitted by blood products. Hepatitis C is also sexually transmitted.
C is also transmitted.
It's also sexually transmitted. It is curable with a drug now. There are actually 2 or 3 drugs on the market that can cure it. Hepatitis B is one of those things that you have to support the body to fight it off, and then you'll always have a little bit of it present, but you can recover from it. It can cause long-term liver damage and other tissue damages. And in people who are weakened by other disease processes, it could become fatal. Hepatitis A, D, and E are all transmitted what's called fecal orally. So it's not uncommon to find the virus in the feces. But if you ingest it, get it in your eyes, ears, nose, it can eventually get into the bloodstream and cause a version of hepatitis.
We go to toilet, don't wash your hand and eat their food. But it is.
But you think that, and one, there's a ton of people that do go to the bathroom without washing their hands. And two, well, I've seen some women, mostly guys, but yes, some women don't. And the other thing though is if you're really washing your hands effectively to get rid of everything, you should be able to sing happy birthday a couple times or the alphabet song once. Most people do not actually sit there and sing A, B, C, D, E, F, G while they're washing their hands.
Most of the time we contact just the fingers and not the whole
Right. So the fact is you could have tiny bits of fecal matter on your hands after you wash them if you didn't wash them long enough.
That's why you saw in spoon. I would think probably more it's mostly the Muslims and the Indians, they eat with their. That's why the customary
but
with the right hand, your white hand with the left hand. But anyhow,
I mean,
I'm a lefty, Yeah, it's a custom.
It is. It's.
Always wash with
But the customs are actually even common in most of Asia too. That your left hand is dirty and.
But I'm a lefty.
And you're rare because you grew up in Asia and they didn't convert you because my wife.
My brother is much older. It was even worse this time. So he would when the teacher walk away, and he would pass his hand back to the left. And then when the teacher comes, he passes to the right. So he's not ambidextrous because when the teacher comes in, she knows that she changed her hand. She'll come from behind and use a ruler and slap his knuckle. Then he'll drop. So now he becomes ambidextrous. He's good in both hands. It's the culture, those days.
Well, no, my wife was a converted lefty.
Yeah.
Because she does everything but write with her left hand. But because of school being growing up in Vietnam.
Learned both. My brother learned both. My stage already they accept lefty, and then
I grew up here in a time where they didn't care and I could write with either hand, so it didn't matter.
I'm writing this way. My other friend is writing this way, just to keep his hands without the ink mark this way.
When I'm writing on flat paper, I always do it right-handed because of that. But if on the board, I don't really care.
Yeah.
Which.
I'm a perfect lefty. Everything I think left, I fall, my hands come out left. So it's difficult to convert me.
There are a couple of things I typically only do with my right hand, and a couple I only do with my left hand, and the rest doesn't matter.
Play games, everything with right hand.
When I grew up, I had a first base mitt for this hand, so I could play first base left-handed, and I had a center fielder's mitt for this hand, so I could play every other position right-handed. But I cannot use chopsticks with my right hand.
Training.
It's just left hand. I can do that just fine.
So do you fall, you stick out your left hand?
What's that?
To break your fall, do you stick out your hand? It's the dominant hand that comes out.
To break a fall, I tend to tuck my shoulder under and roll. So.
No, I would just cringe and I just fall on the butt. But normal people would stick up.
I have no idea.
What's there's a name for this?
Ambidextrous.
No. Ambidextrous is using both. It was asked in the clinical test. Most of the time, people fall and break themselves. There's a name for this. Break the forearm when you break the fall. That's
a Colles fracture.
I forgot already. I did school. Yeah, there's a medical term for this. When you stick out your hand.
A fall on an outstretched arm?
Oh, yes.
Okay, yes.
So F fall on
an outstretched arm.
Outstretched.
Foos.
Foos.
Or fua,
yes, that's what I'm looking for. FOOTS?
No, I think it's just FOOS, yeah.
FOSE, I think, foos. So he came up with the question, I don't know, there's such a word. I went to Google, there is fall on outstretched arm. So it's not foos, F-O, what's the S for?
I don't know.
Shoulder, I think.
Shoulder.
Yeah.
Might be.
Yeah, correct. That's what I'm looking for. It came out in test.
Yeah, it's not a test on or a question on any of my tests, but
I can test before like that. It's the most common.
so end of the GI or GU system, genital urinary. Most common thing, urinary tract infections. And urinary tract infection could be anything from the urethra to the bladder, which are the most common ones, urethra and bladder. But it could go back up to the ureters or the kidneys. So if it's affecting the just the bladder or the urethra, or in males the prostate, we say it's a lower UTI infection. If it's infecting the the ureters or the kidneys, it's an upper urinary tract infection.
Wait a minute, infection from where?
If it's the bladder down, it's a lower UTI.
Bladder down.
And if it's above the bladder, it's an upper UTI.
So bladder down, prostate.
Prostate would be below the bladder, yes.
Bladder down.
Mm-hmm.
And bladder up, example?
Ureter or kidney.
Ureter or kidney.
Mm-hmm. The most common cause, so women get urinary tract infections far more than men do. Couple of reasons. Proximity. So the anus's proximity to the vagina, to proximity to the ureter, right? So basically, so the bacteria from the anus can get into the vagina, and then it can travel to the urethra. The other thing is the female urethra is about 1.5 inches long. The male urethra is usually longer because it's going through the penis. So a longer urethra, well, guys might claim that, but you know, in reality, probably more like 3 or 4 inches long. But in my anatomy class, I'll make the joke about people having that guys will say their urethra is longer than it is. But that extra couple of inches, 2, 3, 4 inches, is enough to make it so that the bacteria moves much more slowly. And so every time you pee, the stuff that didn't make it up into the bladder probably gets peed away. Now, that being said, the most common cause of UTIs in women is E. coli bacteria, because it's found in the feces.
So E. coli is more common in women?
Well, urinary tract infections in general are more common in women, and it's the most common cause overall, and it's the most common cause in women, but it's actually not the most common reason men get UTIs.
What about E. coli? You were talking
E. coli is more, it affects both men and women, but it is the overwhelming majority of women. There's typically only one way guys get E. coli infections.
What?
No, think about another activity that they might do. Anal sex is really is the way guys would get E. coli. Well, or guys who have with women, yeah. And the number 2 and number 3, and I don't know for sure which one is which, chlamydia and gonorrhea are the other big causes of it. Those tend to be more common for guys. But chlamydia and gonorrhea are sexually transmitted diseases that affect the urethra. The terms relating to infectious diseases of the urinary tract. Cystitis is inflammation or infection of the bladder. And then the rest of them kind of are self-explanatory. Nephritis is when it gets to the kidney. Ureteritis, that's just a fun one to say, is an infection of the ureter. Urethritis when it gets just to the urethra. Prostatitis is obviously when it infects the prostate. And pyelonephritis is probably the worst one because it's now actually causing damage to the kidney as a whole and also to the renal pelvis, the area in the kidney where the urine waits to get into the ureter, which now means it's hard for the urine to get out of the kidney. The kidney starts to swell and become damaged.
And that is which word?
That is pyelonephritis.
P-Y-E-L.
That's right here.
Nephritis.
Yep.
Got it.
And like I said, E. coli is the #1 cause. And chlamydia is a second. It's a close second. Well, okay, it's not a close second, but it's a second.
And then gonorrhea.
Gonorrhea would be up there too, yes. And then this is just a picture of the urinary tract. Since you haven't done the anatomy here, I'll do real quickly. The kidneys, and a ureter runs from each kidney to the bladder. Oh, you can't see it, that's right.
Yeah.
So the kidneys,
Yep.
and then that tube that runs from the kidney to the bladder is the ureter. And then from the bladder, you get the bladder right here, and the urethra comes out of it.
Wait, the kidney to the bladder is the
Ureter.
G-A.
U-R-E, sorry.
T-H-A.
No, that's the urethra. Ureter is U-R-E-T-E-R. Ureter.
That is from kidney.
From the kidney to the bladder. And the urethra is from the bladder to the outside.
Why do they not find some words this not so close?
Well, but I mean, it makes sense that they're close because these are referring to the urinary system.
So urine means something in Greek, I think.
Mm-hmm.
What does it mean?
Probably refers to urine, to pee, yeah.
So the second one is U-R-E-T-H-R-A?
Yes.
Urethra. Right, okay.
So infectious diseases of the genital tract. You can see here things that cause infection in the genital tract. Bartholinitis is inflammation of these little glands called the Bartholin's glands. They're basically bulbourethral glands. They're glands that secrete a little bit of mucus prior to sex or during sex. Cervicitis, so infection of the cervix. Endometriitis, infection of the endometrium, the inner layer of the uterine wall. Epididymitis, which is, so at the back, on the back and the top of the testicle, there's a little system of ducts that carries the sperm that have been created by the testicles to the vas deferens, which then goes out.
Men's organs.
Yeah, so these are basically where the sperm stay until ejaculation. If that gets in. Pelvic inflammatory disease is a huge deal. Usually this is PID, yeah. Usually this is caused by repeated infections of chlamydia or gonorrhea. Vaginitis is an infection of the vagina. And vulvovaginitis is the vulva and the vagina, so the external genitalia and the vagina. If disease gets spread by sex, we call it a sexually transmittable disease or sexually transmitted disease. Now they've even gone, STI is sexually transmissible infection. This is the deadening of the language. Basically, we went from a really scary word, venereal disease, to a less scary word, sexually transmitted diseases.
So now they're
sexually transmissible infections. It's like, and they still show videos to high school kids to make them think that if they have sex, they're going to die. And most of them don't believe it. And these can sometimes spread to other related mucous membranes. They can spread to the urinary tract. They can spread to the anus and the rectum. And the big sexually transmitted diseases include chlamydia, gonorrhea, the number one and number two, herpes.
Herpes is not the top. I thought herpes is.
Herpes is a very common viral infection, but gonorrhea and chlamydia are way more common.
According to my ex, when I heard about all these diseases, because I mean I'm not familiar with diseases, he says, oh, 30% of men here has herpes. Is that true?
Well, no.
Yeah.
Unless so the herpes family of viruses includes chickenpox and the viruses that cause cold sores. So if you're using that, yes, it's probably 80% of population that have one of the three.
For men here
but if you're having the herpes, no. Herpes, although the numbers are scary high, it's about 1 in 5 adults.
Where do they get such information if the client don't reveal to their doctor and the doctor don't compile? I mean,
so sexually transmitted diseases are required to be reported to the departments of health. So from a doctor. So if you go see the doctor and they do the physical and they find out you've got it, they have to report that they have a case of it. If it's HIV, they not only have to report that they have a case of it, they have to report the name of the person who has it.
So that's how they get information of how many percent when you see.
And then again, the reason for that is if you knowingly have HIV and you don't tell your partner and you infect them, you have in essence killed them. If you knowingly have herpes and you don't tell your partner, you're a jerk, but you didn't kill them. So they don't need to, they still report that they have a case of it, but they're not going to say it was you that had it.
But then that will be so widely spread, because people don't tell you the truth. Other people, that's why it's so common. As in, no, that's not right. I mean, these are diseases that's just passed on and people are not responsible,
Now, the one disease that is, if you looked at about 80% of adults in America, sexually active adults in America, somewhere close to 80% have HPV. Human papillomavirus.
What is the difference?
Well,
80%.
Somewhere in that range. Well, HPV causes genital warts. Most men who are infected with HPV never develop the genital warts. A large chunk of women who have HPV never develop genital warts.
How come?
Because their immune system is strong enough to prevent it from causing the warts. Right. Now, that being said, too, if you have warts anywhere on your body, you are infected with a version of HPV. So if you have plantar warts, it's a different version, it's a different virus, but it's in the same family.
But then we're talking about sexually...
HPV, the version that causes STDs, it's a huge chunk of the population is positive for it.
And they don't have to report to their doctor?
Well, no, their doctor, it's one of those things, again, they'll report that they have a case of it, but they won't report the name of the person.
But do they have a right? I mean, come to later part, they say we need more information?
No.
No, right?
No.
HIPAA law, right?
With HIPAA, you're protected. And the other thing is, too, you hear this information, and it's true, having HPV as a female makes you twice as likely to get cervical cancer than if you don't have it.
Why is that?
Because the virus causes mutations to the cells. But what they don't tell you is if you don't have the virus, your odds of getting it are about 1.5%. And if you do have the virus, your odds are about 3%.
Scary.
So are you gonna freak out about a 3%? Are you gonna freak out about a 3% chance of a disease?
When I hear people take it so normally, sexually transmitted disease,
But no, herpes is more like 1 in 5 sexually active adults.
And HPV is 1 in.
It's about 3 to 4 in 5, so it's about 75 to 80%.
So
yeah.
HPV is worse than.
HPV is far more common than herpes, but it's not nearly as scary as herpes.
So why is there no proper education to public that
because well, first of all, there's a vaccine. There's an HPV vaccine. And you can get it. You're supposed to give it to kids around 11 or 12 years of age.
You mean kids get vaccine for sexually transmitted disease? So
Well, yeah, because if they have it years before they become sexually active, it's actually more effective.
So is it hereditary if the parent has
No.
HPV?
No, it is completely sexually active. It is completely based on something one person passes on to another person.
Okay, so that means it's terrible, isn't it? If you just keep on passing, then the whole population becomes sick.
But again, it increases your risk for, I mean, the three cancers, it increases the risk for cervical cancer in women, bladder cancer in both men and women, and prostate cancer.
Oh, so the man has more chance of getting disease prostate.
But it only increases it a tiny bit. I mean, it doubles your chance of cervical cancer from 1.5% to 3%. Now, it's one shot once in a lifetime to decrease that chances. But yeah, I mean, HPV is a far more common thing. Herpes is a worse disease because you'll get breakouts of lesions on your external genitalia that burn, that itch, that hurt.
I think that the reason why I asked you by that time is your client always comes with what do you call that?
Cold sore.
Cold sore. He says he's got herpes. What do you know? What do you mean? You say,
Well, that's
so common. 20% of people get herpes. Yes.
Well, that's the same family of viruses.
But that doesn't mean he has.
That doesn't mean he has genital herpes.
It's just one of the symptom outbreak.
Well, it's a different virus most of the time.
He said he has herpes. I think.
It's
personally no.
Okay. It's herpes simplex type 1 that causes most cold sores. It's herpes simplex type 2 that causes genital herpes. It is possible to get type 1 on the genitals or type 2 in the mouth. But the only way that happens is if you have oral sex with somebody who's infected.
That's why I was asking, how come he always looks so bad like that? He just got herpes. That's a sign of herpes. 70%. So are you saying when he
the cold sores are way more common than the genital herpes are?
Would it be consequential if you have this means you have that or no?
No.
Because I said, how you know? It's an old kind of case that he knows very long. So I suppose he knows about the extra information. HPV. So adult can get a vaccination then for HPV?
For HPV, they don't typically give it to people who are over 26.
Why?
Because they figure by that point you've been exposed to it.
That is how that is.
That's how common it is, yes.
Why do people accept life like that? The whole of the country is so full of sexually transmitted disease.
But it's not just here.
Yeah,
If you go,
it's more common here.
No, it's just more talked about here.
Okay,
it's still very common in most of Asia and in most of Europe. It is.
Because it's not our custom to have permissible sex, like you.
It's not your custom, but it doesn't mean it's not done.
It is done. I mean, we have red light district. We know what's happening out there and stuff like that. But it's just like, maybe you're right. We don't compile statistics because in our culture we say we don't do it, so everybody just.
Right, even though you know that a large chunk of people are having sex before marriage.
Because there's no record on this.
I mean, think about it though. In Asian culture, just like in American culture before the 70s, it's perfectly acceptable for males to have had sex before marriage, right?
No.
And not acceptable for females?
No, 70s. I think before 70s we're still not.
No, I'm saying here in the 70s.
Oh, here, yeah.
It was acceptable before the 70s. It was acceptable for men to have sex before marriage, but not women.
Here.
And I would assume it's still kind of that way.
No, not in Asia.
In Asia, that it's acceptable for men to have sex before marriage, but not women.
Well, I say in Asia, it is acceptable for men to have sex before because they pay to get sex somewhere else, but it's not acceptable at all for women to have sex outside of your.
Right, talk about a double standard, right?
Yeah, double standard. Maybe it is true because you don't keep statistics. I'm sure it is more than what it is.
So this is just a quick look at the female and male reproductive systems. The male reproductive system has the testes is their primary organ, and then it's the prostate and the duct system connecting them and the penis.
I drew this for the one month that I took AP2. I started drawing this and submitted for homework. Then Dr. Kong spoke to me about joining your med class. So I took 1 month of class and I drew this just to familiarize it.
And then in the female, it's obviously the vagina, the vulva, the uterus. Yes, the female reproductive system is much more complicated than the male.
It expands and it grows and it shrinks back and it's a miracle.
Circulatory system has the cardiovascular and lymphatic systems together, so the heart, the blood vessels, and the lymphatic vessels and lymph tissues. Excuse me. The big infectious diseases here, endocarditis, myocarditis, and pericarditis, so infections of the inner part of the heart, the muscular part of the heart, or the outer part of the heart. Endocarditis can also affect the valves of the heart, and the endocarditis and the valve damage to the heart is one of the main reasons why people with strep throat need to get treated with antibiotics, because in some people the antigens on the heart valves and on the endocardium are similar enough to those of the bacteria that if you're allowed to mount a full immune response, your immune system may actually destroy and damage the endocardium. Blood should be sterile. If you have bacteria, viruses, or any of those things in the blood, you are septic. If there is bacteria, if there is evidence of bacteria in your blood or a virus in your blood, you're septic. And the scary thing about that is it means that that bacteria, that virus, or that fungus, whatever is not supposed to be there, could get any place in your body.
But if you talk about HIV people, their blood is already.
So I mean, technically they're septic, but they're infected with a virus. We tend to reserve septic more for bacterial infections or fungal infections. We don't actually consider people with HIV septic because it's not going to kill them right now. It's not going to kill them right now, but it will cause problems down the road. Septic usually means some bacteria or virus or fungus that was someplace else that got in there.
How?
Well, it could be a number of things. Untreated strep throat could lead to this, where, okay, you've got this bacteria overgrowing in your throat, and it causes enough damage to the mucosa that a blood vessel is exposed, and it gets into the blood, and now it starts to travel around. Yeah, right?
Or around the neck area?
What's that?
You say the veins, the vessels?
Well, with inside the mouth, yeah. Or, I mean, it could be a vaginal infection. It could be anywhere an infection is that somehow or other gets to the blood.
Vaginal infection?
Well, the vagina is a thin-walled organ with blood vessels very close to the surface, so it could.
So how would you know the blood is sterile? Blood test?
Blood tests, yeah. It should be sterile. There are enough things in your body that are set up to prevent bacteria, viruses, fungus from getting into the blood.
You make it sound so scary, like, oh, you can get sick this way, that way. Oh.
But if somebody finds out if you're septic, if you have an infection in the blood, you will be taken to the emergency department and you will be given an IV of antibiotics.
Oh, I thought you could get a blood transfusion.
No, you just get antibiotics directly delivered to your bloodstream.
Well, that must be hurting then.
No.
I thought if they do like transfusion, I've seen my...
Transfusions hurt, but an IV doesn't. Other than putting the port in or putting putting the needle in, it shouldn't hurt, and that's just a needle stick anyway.
20 over years ago, back when I was in the shipping circle,
Mm-hmm.
I worked for a big company. They sponsored the transfusion machine for my coworker. She's been working.
Right, but transfusion means you're taking blood out of one person and putting blood into the other one.
They assembled her whole room. It's just dialysis. She's doing dialysis at home.
Uh-huh.
Before now, it's
right, that's still a transfusion. Your blood is coming out and going back in, and the forcing of the blood cells back in is painful.
Yeah, take a whole day, and next day she's like, you can see black eyes, but it saves her the whole day sitting in the clinic.
Mm-hmm.
They paid like $100,000 for the whole system. Scary, you see the blood go through the tube, and say, wow, our body is so amazing. From here, clean the blood, go back to the body.
So lymph infections, lymphadenitis, any lymph gland that's infected, or lymphadenopathy is a disease of the lymph nodes or lymph glands. And lymphangitis is specifically of the lymph vessels.
And lymphadenopathy, what is it?
Lymphadenopathy
Yeah.
is an infection of the lymph nodes or of the lymph organs. So the spleen or the tonsils or something like that.
Which of these is exam based? Everything?
Mm-hmm. Just if you think about it, about half the stuff we've done is medical terminology. Something-itis is the inflammation of whatever that something is. This is your anatomy of the heart. Right side, left side. The right side of the heart has deoxygenated blood. The left side has oxygenated blood. The left side is sending blood out. The right side is receiving blood. So blood comes in through the superior and inferior vena cava to the right atrium. From the right atrium to the right ventricle. From the right ventricle, it goes out the pulmonary trunk, which splits into a right and a left pulmonary artery. It takes the blood to the lungs, where the lungs will take carbon dioxide away and give oxygen to the blood. Then from the lungs back to the heart, they travels through the pulmonary veins. Pulmonary veins go into the left atria. The left atria empties into the left ventricle, and then that goes out the aorta to the rest of the body.
So the aorta is too big. What do you call that? It's one is upper and one is lower.
So the aorta starts by coming out of the out of the left ventricle, going upward, and then it arches and then comes back down. So it's not two vessels, it's two parts of the same vessel. There's an ascending part that goes up, there's an arch that goes across and over, and then there's a descending part which comes down. Yeah.
So my godson, when he was born, well, what we heard is actually he had the other way around.
So he had the pulmonary trunk and the aorta were transposed. So he probably had a series of problems called the tetralogy of Fallot, and that requires heart surgery at a very young age. So
when he was born,
yeah,
he's now 31 years old already. That's why he got mother. When he was born, my sister-in-law and my brother-in-law both work for the government department, so they thought, no need to go gynae, whatever. They just sign up. The normal hospital around the hometown hospital, and it was her first pregnancy. He came out like she had a hard time. He just refused to come out, bite her lips and force it. She was in the hospital the whole day, and then in the end, after trying everything, doctor says we got to get him out. He's a huge baby. He came out 9 pound 9.
Wow.
Yeah, 9 pound 9. That's why she was suffering from here and suffering from below. And when he came out, he said, "Oh my gosh!" In the end, they had to use grab the
forceps. Yeah.
Forceps. So his head was longish. We're kidding him. You look like our Prime Minister Lee Kuan Yew. You know, like Lee Kuan Yew, his head is long. So we're saying, "Oh my gosh, it's a break our family record." I'm 8 pound 8. I'm the biggest in the family, but look at my size. Because it's just normal hometown hospital. So he had to be incubated because it's yellow. And
Mhm.
yesterday we saw he was in the cubicle, we couldn't go in. His legs was like one side is darker purplish color and the other leg was different color. So we were asking the nurse, there's something wrong, can you check? He says, no, we don't have doctors doing night shift. He should be fine. But my brother and I would say, no, I think it's serious. We better transfer him to general hospital. Luckily we asked for it because he reached the hospital, code red, and then straight into the ward and then doctor came and says, yeah, he had a heart failure. So we dare not tell my sister-in-law. We just said that he was a little bit ill, so they transferred him to general hospital. After a week, because she was hurting here, hurting there, hurting everywhere.
Mhm.
So my brother and I were both two that's walking up and down the aisle waiting for him to come up from
Right,
the
right.
hospital. Yeah. Then he spent a good few years surgery. That time the Prime Minister himself just had the balloon. They just introduced the balloon system 30 years ago. That means they put the I don't know what you call that to flow because it's blockage.
Mm-hmm.
But because it's
No,
a baby, they don't have
angioplastic.
the size. Yeah,
Mhm.
angioplastic. So they had to operate. So that's my experience with.
Okay.
You call this what? What do you call this? You mentioned the.
It's called the tetralogy of Fallot when you've got the transposed arteries and the other things that go along.
Tetralogy.
Oh,
That's a big.
yeah, and the Fallot, Fallot. If you just type that word into Google, you'll find all you need to know.
Fallot,
Yeah.
Fallot, but pronounced Fallot.
It's French, yeah, so it's Fallot.
That's a word for that.
Mm-hmm.
Yeah, they mentioned there are certain percent that happens. Like
We probably should do your nervous system ones here.
yeah, last one, right?
I think it is.
Yes.
So the central nervous system is the brain and the spinal cord, and the peripheral nervous system is everything else. There is no such thing as an indigenous microbe to the central nervous system. So blood in your nervous system, and your urine for that matter, should be sterile. Those are things that should not have microbes in them, and if they do, it's a sign of something that's wrong. And if you have an infection of the brain, well, you put itis after the part that's infected. So encephalitis, encephalo means the brain inside the head. So encephalitis is inflammation of the brain. Meningitis is inflammation of the meninges. If they're both inflamed, it's meningioencephalitis. These are caused by a number of bacteria and viruses. And the big sign of meningitis that everybody needs to be aware of is a stiff as a board neck. Not just neck stiffness, like where it hurts if I bend it. You can't bend it. Even if I tried to force it, I couldn't bend it. And if I got a little bit of movement out of it, you'd probably be seeing shooting pains all the way down to the feet. If you see that, you call 911. You get your patients out of that building, you get your staff out of that building, and you have everybody go get checked for bacterial meningitis.
Meningitis is contagious.
Bacterial meningitis, both of them are contagious. Bacterial meningitis is deadly within hours.
But I hear clients talking about I have meningitis. I didn't even think twice about it because I thought it's just.
So bacterial meningitis is deadly within hours. Viral meningitis will usually resolve on its own without any sort of treatment. The problem is they look alike.
So when you talk about
the super stiff neck,
it's a symptom for both viral and
it tends to be worse in bacterial, but if you see the symptoms, you send them to the hospital. They will pump this person full of antibiotics before they know for sure whether it's virus or bacteria, because bacterial is that deadly. But people who have viral meningitis and don't get it treated tend to survive on their own. They may have some long-term damage. They may not.
Symptom then, how fast does the symptom comes about, like the shooting pain in the neck? It's just cramponess.
It tends to come on very, very quickly, within minutes to hours. And like I said, if you see those signs and symptoms, they are hours away from death.
How do they get meningitis?
Meningitis? It's the bacteria is inhaled. The virus is inhaled. It's respiratory droplets.
From someone who already had
Someone who already had it.
So should I be alarmed if a friend tells me I have meningitis? I should not.
If somebody's telling you they currently have meningitis, they shouldn't be in your office. They should be in the hospital. If they had it, you shouldn't be worried, because if they had it and they're still with you, they got to treat it appropriately.
Yeah, a guy told me that, and I didn't even think that. Okay, got it.
Myelitis is inflammation of the nerve, of the spinal cord.
Myel is spinal.
Myel, M-E-Y, or M-Y-E.
M-Y-E is spinal.
Spinal, yeah, it's spinal cord. And specifically, it's the gray matter of the spinal cord. And the disease that everybody has heard about this is called poliomyelitis.
Oh, yes.
There's your anatomy of the central nervous system right there, the brain and the spinal cord.
Lots of acupuncture points.
Oh, yeah. Especially between the vertebrae and along the sides of the vertebrae. Your governing vessel and your bladder meridians. Excuse me. And if you notice, those are the things that tend to control much of how the body acts, right? And then the last picture here is the next picture is the meninges. And those are basically just the protective coating around the brain. So meningitis, inflammation of the meninges, and they can cause, basically you can get these by injecting them and all of this. The three major bacterial causes: Haemophilus influenza, Neisseria meningititis, and Streptococcus pneumonia. Now I'll tell you this right now, Haemophilus influenza and Streptococcus pneumonia are not uncommon virus or bacteria.
Not uncommon.
They're not uncommon. In fact, if you sampled a bunch of people's mouths, many of them would have it.
Such a fancy name, and we have it with us.
Yeah, but if it gets into your blood, it can get to your brain and cause these huge problems.
And what is this Neisseria?
Meningititis. It's a bacteria. Neisseria family is the family that has gonorrhea in it.
Ooh, sexually transmitted.
But this one's not sexually transmitted. This is respiratory transmitted.
So bacteria, but respiratory. So why is it from the gonorrhea family? Gonorrhea is actually a sexually transmitted disease.
It is a sexually transmitted, but
say it's part of the gonorrhea family.
Well, it's just the first word in there.
You're just talking about the word.
Right.
Okay.
It's the genus. If you're going genus species, it's that part of. So they're in the same family, but they're not the same disease or the same bacteria. And then opportunistic infections. Remember, these are the things these are bacteria or other microbes that tend to be around, if not all the time, at least quite regularly, and don't cause problems in most people. So you've been exposed to these things before and not gotten sick. But if something is affecting your immune system, suppressing it in some way, if you're sick from something else, if you have a disease that lowers your immune response, if you're taking a medicine that lowers your immune response, these things could become problematic. So Aspergilla is a type of, it's a fungus that is everywhere. It likes to hang out around fruits and nuts.
Uh-oh, my favorite.
So, I mean, if you have eaten peanuts that you haven't washed off, there's a good chance you've eaten Aspergillus.
I eat peanuts a lot.
And that means you've been exposed to this, but because your immune system is fine, you haven't had a problem with it. If you inhale that and your immune system is suppressed, it can cause a nasty lung infection.
So that means I have natural immunity to Aspergillus.
It means your immune system handles it well, at least right now. Candida Candida albicans is a fungus that we all have all over our body, especially in the moist, wet places. So your mouth, your anus, and in women the vagina tend to have a little bit of this. If the normal microbes are doing their job and they're in balance, you don't have a problem with this. But if you do something to wipe out a whole bunch of the microbes,
so female whites are not good then?
So on the external, they're okay. I wouldn't stick them inside.
Yeah.
The big thing, a lot of women when they take antibiotics, one of the things they notice a few days after they started the antibiotics is a vaginal yeast infection.
Yeah,
well, that's Candida albicans. That's the fungus that.
So because of the antibiotics you take,
it's killing the normal bacteria, so it's not right. Cytomegalovirus and herpes simplex infections tend to be opportunistic. Now, this is the case where if you're infected with a cold sore, say, if you have the herpes 1, or if you have genital herpes, herpes 2, people tend to have outbreaks around stressful times or around times when they're sick with something else. So their immune system is actually suppressed, and now this thing that has been held at bay comes back. And for adults who have had chickenpox as kids, this is also when shingles is most likely to come out.
You're talking under
cytomegalovirus and the herpes viruses.
Okay, so that means you're talking about herpes would be cold sore.
Cold sore, chickenpox, or genital herpes, yeah. Tuberculosis, malaria, toxoplasmosis. I don't know that I would say that those are things that you typically find around you.
What's toxoplasmosis?
It's a fungus that is found in the droppings of the feces of certain animals. So if you cats, you're not supposed to change. If you're pregnant, you shouldn't be changing cat litter because of a number of different funguses that are in there that you could breathe in. Tuberculosis and malaria, they tend to get you. It's not that you tend to have them around you a lot. If you sampled the average person, they would not have tuberculosis on their skin or anywhere in their body. But if they got exposed to it and their immune system was strong, there's a good chance they wouldn't get it. If their immune system was suppressed, they would get it. Make sense? Mycobacterium avium and pneumocystis are other opportunistic infections. Emerging infections, these are the things that either have been wiped out or have never been around and that are coming back now. H1N1, or the swine flu from a number of years ago, was just a version of the flu that had specific markers on it on the outside, and they called them H1 and N1. That's why it's H1N1 flu. Swine flu is one of the few cases of a virus that can make one animal sick and then make another one sick. So swine flu can make pigs sick and make humans sick. Bird flu does not make birds sick. It just passed on from the birds to the humans. So if you see a bunch of dead birds, it doesn't actually mean that they got swine or that they had the bird flu. But if you see a bunch of birds living in a really, really tight space with poor sanitary conditions, they may have the bird flu that isn't making them sick, but it'll make you sick. Cryptosporidius was an infectious disease that people got from drinking infected water, whereas the different versions of the flu are spread by respiratory droplets. Ebola was the big one a number of years ago, if you remember that scare. And the thing is Ebola is still an emerging virus because it's still only endemic in certain parts of West Africa, but it's been spreading to Central Africa.
Did they find a vaccine for that?
Didn't find a vaccine, but they figured out how to use the serum of the infected people to make a treatment for it.
I remember there was a doctor that went there and he got infected, so they said they treated him and he recovered.
Yeah, so all of the people on that outbreak a few years ago in North America who got infected in North America were cured of the disease. The only person who died was patient 0, the one who brought it from West Africa to Texas. He died.
Why then? Because he didn't get the vaccine in time?
Well, he didn't get the treatment in time. And then the people who were treating him, all the other people who got it were healthcare workers who weren't taking proper precautions, but because they were healthcare workers, they were in a place where they knew what they could do, and they were sequestered, they were kept, they were isolated, and then they were treated.
So now it's in Central Africa?
It's moving to Central Africa. Hantavirus actually is very similar to Ebola. HIV and AIDS is definitely still getting bigger, and we haven't controlled it terribly well. Monkeypox.
I thought AIDS is getting under control.
So
now that people are more aware of what they should not do.
People in the West are more aware. So the incidence of HIV in America and Canada is way down. So the number of new cases is way down. The number of overall cases is actually way up because people, well, even in America, the number of cases are way higher than they've ever been because people aren't dying within 2 or 3 years of diagnosis. If you go over to parts of, especially Asia and Africa, where nobody talks about it, the cases it's still a problem. I mean, India and much of Southern Africa is still dying in large numbers from it.
WHO would have statistics, right?
Yes, you can look it up. Human monkeypox, Lassa fever, legionellosis.
What is human monkeypox?
Okay, so have you had chickenpox or seen somebody with chickenpox?
Yeah.
Okay, now imagine instead of the bumps being this big, they're this big.
So it's like chickenpox. And how many percent of people get that?
Oh, it's relatively rare, but it's something, again, in South America and parts of Africa, it's becoming a problem. And the Lassa virus is another hemorrhagic virus. Legionellosis, or Legionnaire's disease, is basically a nasty respiratory disease of that seems to have outbreaks every so often.
Yeah.
Even in the U.S., yeah. Lyme disease is definitely a big problem. It's an American and Northern European problem. So basically throughout America and Canada, any place where there's a lot of forest and woods, it's a problem. So the Northeast U.S., the Upper Midwest, and the whole West Coast, it's a big deal. Marburg hemorrhagic fever is another thing like Ebola, hemorrhagic disease.
Ebola.
It's similar. And then SARS. You probably remember that.
Yeah, I had a shop at that.
Were you over there at the time, or were you?
My shops are also closed because nobody else comes out. Yeah. And
then I always loved seeing the pictures of people in Beijing wearing the masks, and the news media here was making it out to be they were wearing the masks because of SARS, and it's like, no, they were wearing the masks because the air is too dirty to breathe in Beijing or in Shanghai.
Also they do that. They do it anytime.
But in Tokyo, that's more because they're germaphobes, isn't it? The air isn't that dirty in Tokyo.
No, I think it's basically the air quality is bad. China's air quality is bad. But it's common for them to wear that. A lot of Chinese is wearing that in Singapore too. That's how you distinguish Singapore from China.
Re-emerging infections, things that we thought had gone away that are coming back. Here's the list that the book gives you, but of course the big, by the way, the one emerging infection that the book doesn't cover is Zika. because nobody knew about it 3 or 4 years ago. It was 3 years ago they did, 4 years ago they didn't. I'm reemerging. Probably the biggest one to talk about is measles. That's not on there because, again, this book was published 3 years ago, 4 years.
So when did measles?
Measles became a big issue about 2 years ago when the anti-vax movement got to such a big point that so many people weren't getting vaccinated that, yeah. And in fact, this whole outbreak that hit the West Coast.
When? 2 years ago.
Oh, about a year and a half ago.
I wasn't reading anything.
Was when a parent who did not vaccinate their kids and wasn't vaccinated himself for measles took a vacation to Saigon. And measles is endemic in Vietnam and in China and much of East Asia. So both of them brought the measles back, and the kid spread it to all these other kids in Seattle, and basically now measles is a thing again in the U.S.
Miserable measles.
Mm-hmm.
Wow. I must go Google it now.
MRSA.
A Vietnamese wife, that's why he went to Saigon? What?
No, he just went. I don't know why they went, but.
But isn't that like usually the advice if you travel to those countries you must.
Absolutely, it is. If you travel outside of.
Because he caused an epidemic here.
He should be. He should probably be imprisoned.
He should be shot, not just.
No, I shouldn't be shot. He should be put in prison for infecting people.